Hi, I'm Jeff Holden. Welcome to the Nonprofit Podcast Network. Our purpose and passion is to highlight a nonprofit organization in each weekly episode, giving that organization an opportunity to tell their story in their words to better inform and educate the respective communities they serve, as well as provide one more tool for them to share their message to constituents and donors. Our goal is to help build stronger communities through shared voices and to both encourage and support the growth of local nonprofit organizations through podcasting. Thanks to our partners for their support in getting these stories told. CapTrust, fiduciary advice for endowments and foundations, and Western Health Advantage, a full-service healthcare plan for individuals, employer groups, and families. I'm proud to welcome our newest partner to the program, CORE, Interim and Fractional Executive Leadership, Comprehensive Back Office Support Services. We work in it so you can work on it. Visit cxore.com. What if I told you that half of all men and a third of all women will face cancer in their lifetime? That's the reality, and it's why today's conversation matters. This episode, I welcome Alexis Padilla, Executive Director of the American Cancer Society for Sacramento and the surrounding 23 counties. Alexis brings us inside one of the most recognized and misunderstood organizations in the world. We explore how American Cancer Society is fueling groundbreaking research, providing hands-on patient support, from rides to treatment to free lodging, and fighting for policy change so everyone has a fair shot at preventing, detecting, and surviving cancer. We also dive into Cultivate, a bold new Sacramento-born initiative that connects food, nutrition, and cancer prevention in innovative ways. This episode isn't just about statistics. It's about hope, community, and the real people who make sure no one fights cancer alone. If cancer has touched your life, or someone you love, this conversation matters. It just might change how you think about what's possible in the fight against this disease. Alexis Padilla, welcome to the Nonprofit Podcast Network.
Thank you. Thanks for having me.
Boy, it's been some time, hasn't it? We've been talking about this for a while, and probably to your benefit, because you're relatively new to the region, right?
Yeah, I've lived here for 8 years, but in this role and serving this community for a year and a half.
So
yeah.
Here we are now, better than 6 months ago.
Yes, for sure.
Which is great. Yours is an organization of mammoth proportion. Everybody knows the American Cancer Society. It's such a feared disease in so many ways. It strums up a lot of emotion, a lot of anxiety, a lot of angst when people hear it. But the good news is that quelling that fear is just the tip of the iceberg of what the American Cancer Society does. And you're built on a platform of pillars.
Mm-hmm.
If you could walk us through what those pillars look like as an overview, and then we'll dig into it a little bit deeper as we get going.
Yeah, I love that we started with this because most people that we chat with have no idea what we do as an organization, but of course recognize the brand. We've been around for, it's 114 years now.
Mm-hmm.
But yeah, so I like to explain it with some examples that were given to me when I first started, when I was trying to learn about it. And so yes, we have 3, I'd say, core pillars of our work. The first and probably most well known is our research arm, right? So understanding cancer, studying what is needed to understand it and treat, prevent disease in general. I think, there's got over 50 Nobel Prize winners from the research we funded. And all of that then bleeds into our patient support pillar. And so patient support, born out of the understanding of science, what we learned through science, is the need to, how do we step up and help patients through their cancer journey? Mm-hmm. And scientifically, the biggest hurdles universally are transportation and lodging. And so, yeah. And so we started out there, what can we do in these spaces? And from there, over the last several decades, grown into a whole library of resources for patients of how do we support people from the minute they're diagnosed all the way through into survivorship, which now means a lot longer in lifespan than it used to even 10 years ago. And so constantly evolving and learning as we go. And of course, again, fed through the understanding of research and science. And then the third arm being our policies. So American Cancer Society Cancer Action Network, or CAN for short, is our third arm. And basically, that's all things policy reform. So at our core, we believe every single human being should have the right to detect, treat, prevent cancer in general. And so we advocate daily. It's a full-time job for that team to be advocating for policy reform at both the local, state, and federal level so that everybody has that access.
In the distribution of funds, and I know this wasn't a question that we had initially, do you have any idea what that looks like in the overall allocation from
percentage-wise?
from research to people to advocacy?
Yeah, I can find that out. I don't know the
Sure.
exact percentage. I know, for example, with research, we have 1,000 in-house researchers.
Wow.
But then we also fund research into different institutions. We're the largest funder of research outside of the federal government. We study all cancers, so we're cancer agnostic. And then the patient support, which is a newer team, right? So understanding, it goes all the way down to fundable opportunities like our PAUSE program, which is therapy dogs for cancer patients, so, or we have our Road to Recovery program, which is free rides to treatment. And ironically, Elk Grove actually has some of the highest concentration in the state of California for usage of our Road to Recovery, and it's volunteer-based, so we have a big, mighty powerhouse of volunteers behind us, too, and helping us deliver a lot of the work. But from a funding perspective, I would have to actually look into the percentage of that. ACS CAN, too, is also a separate org that does their own pillar of fundraising as well.
Let me ask you something about
Yeah.
that Elk Grove. Is it because, we all know that's a satellite of Sacramento. It's a suburb. Is it just because the orientation of volunteerism is so high, not because there's an excess of cancer cases?
Correct. Yeah. So, I think it's from what I've learned, because it was a mystery when I first started
Right.
why we had such incredible numbers in Elk Grove. It's, one, it's because it's people volunteering their time and gas money, to be driving people to and from their treatment. I think it's the trickle effect of you tell your friend you're so fulfilled by this opportunity, they jump on the bandwagon with you. So word of mouth progression. You also have healthcare systems there that are talking about the opportunity to patients. So you have utilization of the resource. You have, I think we've met a couple drivers. I met this one driver, and my first question is always, why, what prompts this? And the guy just said, I love driving. I was like, oh, that wasn't what I was expecting. But, it brings so many different people to the table. And he is on his 300th ride last year.
Wow.
Yeah,
Good for
in Elk
him.
Grove. So, I think
That's
it's
great
that
to hear.
ripple effect. Yeah.
It's just great to hear. If there's one pillar of greatest interaction, which would it be? And by that, I mean it from the patient perspective. Where would I find myself most frequently when I connect with the organization?
Yeah. I like that question because it also feeds into why people don't understand the depth of what we do in the cancer space. So, I was chatting with someone the other day, and they said, you don't toot your horn enough, for us as an organization. And I thought that's a great way to put it because, simultaneously when I was coming into this role, someone told me that I'd be hard-pressed to find a cancer case that didn't intersect with ACS in some capacity from start to finish. So I think it's, understanding, for example, for us women, when you get a mammogram, ACS has touched that. We funded the research that shows that the mammogram is the most efficient way to detect breast cancer. So you're not going to link that automatically to ACS when I get my mammogram. I just say, thanks, Kaiser, right, for allowing me the opportunity to screen for cancer. So I think we're the behind-the-scenes beasts that you want in your corner, but not necessarily interacting on an everyday basis unless you then become diagnosed with cancer. So then I would look at us, our cancer.org is visited every day.
And for the benefit, cancer.org is the website URL.
ACS. Yep, exactly.
Which is a massive site. What a
Massive
comprehensive
site. Yeah, we would then intersect with anybody touched by cancer or looking for answers, right? So you think of how much your life is turned upside down with a cancer diagnosis. You instantly want to learn more about your specific cancer. I mean, we go down into every detail of every cancer we've studied, and we have I didn't even know this. We have a 120-page caretaker guide. I blast that from the rooftops anytime somebody tells me their loved one has been diagnosed. Definitely we have an 800 number that's open 24/7. You can call any time of day, night. It can be, I'm worried about my spouse. It could be, I just got this new medication. I want to ask somebody else's opinion on it. It could be literally any question under the sun, and it's run by real people. And we also have, they can both from the hotline number, but also digitally you can type in your zip code and a whole list of resources will pop up to you. I tried it when I first started and I had over 2,600 resources.
Wow.
And this just lists a lot of just the available community support that's around, but also very specific directly to cancer too. So then I think that's when your interaction with us as a brand becomes more intimate.
And brand is a perfect segue to the next question, because the brand is so iconic. It's so pervasive, so agnostic, so aware to anything cancer. That's the first thing you think of, American Cancer Society.
Mm-hmm.
Maybe not directly to the URL, but and you recognize that little symbol that you've got. I don't know quite what that is.
Yeah.
But it's so aware for so many people. That has its pros and cons sometimes. How does it work to your benefit? And if there are any negatives, what do you see?
To our benefit, I would say, we aren't the small nonprofit, right? So we're national in scope, actually global in what we influence, but so there's that brand recognition. I don't have to explain, what we do. As soon as I say American Cancer Society, there's recognition. I would say the disadvantage is kind of what we already talked about, where of not knowing or understanding what we do as an organization. But also, I think specifically for our region, and I'll be as bold to say it, is that there's so much interest in impact locally that when you think of us as a brand, you think, well, they're not local, they're national. And the reality is we actually are very much so local. And have so much potential to expand in what we could be capable of achieving here, if we're brought to the table like a what would be coined, in air quotes, a local nonprofit.
Yes.
I'm also a big believer that you need both. You need the small mom and pop, which and you need the big behemoth.
Well, and we're going to get that opportunity to touch on that,
Yeah.
because that is significant, and we do see that with the other large organizations that we speak with, the Salvation Armies or American Heart Association. You are the large global piece of it all with the local influence and activity. If it's only recent that there's been a refocus, let's say, on Sacramento since you've come back a little over a year and a half ago. You were a subset of the Bay Area, if I'm not mistaken, right? Sacramento.
A couple times, yeah.
Kind of in and out, in and out. What today now is the geography that you're responsible for? For what is considered Sacramento? Yeah,
so we're a year and a half into being what is coined investment market. So the understanding that if we put an org chart in place, so I'm actually the first executive director we've ever had in this region, but we have a campaign that's been here almost 30 years. So we've definitely had presence here. It's definitely peaked and valleyed. COVID was really a big hit for us too here locally. As you mentioned, being part of the Bay Area is tricky. We all know culturally we're very different.
So much better.
Yeah, so much better. So much more, innovative. No. And like staff footprint. So I actually came into an almost entirely vacant team. And I mean, the pro to that is, picking the people who work alongside you every day. And we're just shaking it up, right? We're trying new things. How do we show up for this community in new and creative ways? While still understanding what we can do as an organization and how we partner with healthcare systems, with community clinics, food banks. I mean, you name it. We want to work cohesively
And we're
together.
going to get
Yeah.
to some of the
Oh,
creative and innovative ways, things that
you
you're
asked me
doing.
the geography too, and I
And the
realized I
geography,
didn't
how
answer it.
big, yeah, how
We're
big is your,
23 counties,
yes.
so just a small, I'm just kidding. I think the easiest way to say it is everything but the Bay Area and Napa.
Okay.
Yeah, they got
Well,
the
and
tech and the wine, and we've got everything else.
right? We have wine. We
We do
have a
have
little bit
good
in our
wine too.
foothills.
Yeah, we
So
do have wine.
we recently had American Red Cross in
Okay.
similar 26 counties. So you guys
Yeah.
both have these huge
It makes sense from.
geographies.
I mean, it doesn't. But for a national organization, right? You're looking at your biggest metro markets
Mhm.
are typically where you'd set up a market geography. So we're that mid-sized grouping,
Mhm.
I'd say. Pretty similar to like a Kansas City or St. Louis in size for metro.
You touched a little bit in the answer to the geography on just innovation and people that you might work with when we're talking about local, because you are the local entity of the big
Yeah.
organization. Who are some of the people that you would collaborate with? Who might we see you engaged with without me just making assumptions? Because I know you surprised me when we talked about this the last time. The assumptions are there,
Yeah.
but go ahead, share some of those.
I mean, this comes to, we've talked about this, the dream state too, of what I, in a perfect world, right, how we would look to
That's another
collaborate. I
question.
know,
So hold
sorry,
that
I'm
one.
not
You can't
jumping above.
don't go that far.
I'll go more in depth on that one later. But I think our natural partnerships are going to be healthcare centers, right,
Mhm.
or health systems, especially those that have cancer centers. So we operate under that patient support pillar. We have, I think the easiest way to understand their role is like a consultant figure to cancer centers, being able to help with creative idea planning, grant administration, right? So understanding when we have different open cycles for grants for these healthcare systems to apply for, their researchers. Um, we're fortunate that we've opened back up the tap to UC Davis funding, so that's a very natural partnership there with the work we could do in the science space. I also think we're not short on nonprofits here, and
This
so
is true.
my current belief system is we don't need to stand up more programs here. I would love a network where we're integrated into programs that already exist. When we talk about transportation, um, what are things we could do here locally to advance, recruit more drivers, right, for our Road to Recovery program, partner with like a paratransit.
Hmm.
I was just chatting with Greg Fishman, and he was like, "Have you talked with the,
Tiffany?
transportation?" Yeah.
Yeah.
Well, no, not Tiffany. Yes, I've talked to Tiffany. Love her and the work her team. Her
Hmm.
team is amazing. And just how do we work with the city? How do we work? There's just so many opportunities of how we could show up for patients. I think, and I know we'll get to it. Cultivate, which we just launched, is a big part of that. Focuses on how do we collaborate? How do we act as a convener? Bring people to the table to think, perhaps it's not, you might live in the transportation land, but what does it look like if we brought food from a food bank to patients, or medically tailored meal companies, working together
Hmm.
with healthcare systems to identify patient need, specifically for cancer patients or beyond. I think some of that exists from what I've learned here locally around hypertension and diabetes. The cool thing is that what you do to lower your chances to heart, but also chronic disease in general, is the same way you would work to prevent cancer.
Hmm.
So 42% of cancers are considered preventable and attributed to lifestyle choices. And so what does it look like to partner with organizations that are already in this space? When I think of chronic disease, I came from another big blockbuster organization before. And I was not putting, we were doing really great work around hypertension. I did not put cancer in that same bucket. And so, one, how do we add cancer to the conversation? And then what does it look like to collaborate more strategically?
Yeah, not to mention hypertension, result of stress,
I mean, it's so
you
layered.
know,
Yeah.
just
Access to
it all
food, healthy
adds to,
food.
correct,
Yeah.
correct. We'll be back with more from Alexis Padilla of the American Cancer Society in Sacramento right after these messages from those who make our program possible.
Hello, this is Scott Thomas with Cap Trust in our Sacramento office. I specialize in working with local nonprofits and associations. Annually, we survey private and public nonprofit organizations across the country to better understand challenges they see in today's environment. In our more recent survey, we heard concerns about proper board governance, mission aligned investment, and how to implement alternative investments. If you would like a copy of the survey or to discuss your organization, look me up, Scott Thomas at captrust.com.
I'm thrilled to have Western Health Advantage partnering with us as they do so much to support so many nonprofit agencies in our community. As a truly local health plan, you'll find individual and family options, employer options, plans for CalPERS and Medicare Advantage. From medical services to pharmacy, health and wellness support, as well as behavioral health care, Western Health Advantage has a plan that fits what you need. As an employer, for profit or nonprofit business, individual or family, you can find more at westernhealth.com. I'm speaking with Darrell Teat, CEO of CORE. Welcome to our family of partners.
Thank you so much, Jeff. We are really excited to be part of the family and contribute to the work that you all are doing.
What is CORE all about?
CORE provides fractional and interim executive services, along with comprehensive back office solutions that go into our client sites and do the work to give them the capacity they need in order to move through transitions, whether that's planned or unplanned. Or companies also work with our accounting and finance, back office solutions, human resources, technology, and administration.
Why are these services such a lifesaver for small and mid-sized organizations?
Great question, Jeff. The reason why our back office solutions add value is because we save them time and money, anywhere from 20 to 30% of what they would spend on that back office solution. We work in it so they can actually work on it.
I have to believe that there's somebody right now listening and thinking, I could use that kind of help. What's the best way to get in touch with you, Darrell?
The best way is at our website, cxore.com, and contact me directly at dteat@cxore.com.
Darrell, thank you for your investment and commitment to supporting our messaging. And if you're interested in learning more about how CORE may help your organization, visit cxore.com. As a legacy organization, what you do has these huge tentacles across the country and global in some way, shape, or form, I'm sure. When we look at it on the local basis, just local for your 23 counties, how are you funded? How do you, I'm sure American Cancer Society is saying, okay, here, we'll give all this money to Sacramento. I'm sure it's locally originated. You have to prove the value of the community to continue to sustain. What is it you do?
Yeah, so we're not a franchise model in that I know some big ones are. From a funding perspective, I'll go with the word national, in the way our organization is shaped, essentially everything we raise here locally, unless specifically designated to one thing in particular, does roll up to that big pot. And then as a pot, we as an organization would decide, which areas of investment into the different pillars of our work, right? So an example of that is, for example, how a researcher at UC Davis applied for funding through his grant for his big idea. ACS said, excellent idea. Here is, 11 or 12 months worth of funding for this research. Actually, I think he has 2 years research funding project. Another example of that would be through our patient support team that operates as consulting to these cancer centers. They worked with Dignity Health here locally to address a problem in lung cancer screening rates. And then through a grant from ACS, so money raised locally, right, into the big pot that overflows back into our community, they did a year-long project to increase screening rates, which normally annually are about a 9 to 12% increase, and they saw a 45.4% increase in lung cancer screening rates, which is phenomenal.
It is truly phenomenal.
Truly phenomenal. I mean, best in class. And then that has now been used as a methodology to implement in different cancer centers across the country. I heard our local team taught a team in Florida. So you couldn't get further away in geography where our local teams are shining through the investment that's raised here locally and then up and then back down.
And so you would see influence on research projects that isn't typically your budget. They are Sacramento, but it's going to be dynamic over the course of years as things come and go. UC Davis has a project, or Dignity has a project, or whomever sets that up. So those aren't really your operating. What is How do you raise funds for you, for Sacramento's operating?
That is through, so we have 2 campaigns here locally. Each has an annual event.
Mhm.
So we have our Making Strides Against Breast Cancer, which is the next one on the calendar,
That takes place
October 12th every year.
every year in October?
Every year in October,
Okay.
National Breast Cancer Awareness Month.
Perfect.
It's at Sac State for the 3rd year now. It's been there. It was at the
Another
Capitol.
collaborator then with Sac State supporting.
Absolutely. I
Uh-huh.
know. I have like pie in the sky goals of, can I get Shaq to like shoot some hoops or something on the Carnival Festival area. But yeah, we've been there for 3 years, but the event itself is 27 years young.
Yes.
And so that's at like your typical walk model where you would come, it's free to attend. You don't have to fundraise, although highly
Mhm.
encouraged, right? That's a really unique campaign because 100% of what you raise goes directly to breast cancer research. And so that's about, let's see, last year we raised about a good 2/3 of what we brought in from the community. I didn't believe it when I first started, but it was told to me there was 20,000 people that attend, and I thought, how have I lived here for so long and I've never heard of this event? And sure enough, that many people showed up out of the woodwork. And so I think it's the coolest. I mean, we put almost nothing into the marketing of that event and when I first started, and I think, wow, this many people showed up because it's the coolest grassroots movement I think I've been able to witness in
So
my
we'll tell
time.
people right now, mark your calendars. Just keep an eye out for October
October
and pay
12th.
attention. What's this year? But
That's
if
this year, yeah.
the podcast goes a little bit longer, they
Yeah,
pick it
yeah,
up.
yeah.
We don't want to date that. This is 2025, but every October is when
Yep.
that event takes place. There's 20,000 plus people, which
Yeah,
it's always a good month if you get in early.
yeah. We have
So-
people that come from Humboldt County,
Wow.
which, wow, that's amazing.
Mhm.
And then the opposite end of the year, we just launched our Cultivate campaign. So that'll be in the spring, likely May 2nd of this next year, but April, May timeframe.
Okay, and we'll touch on that in just a second. Time to dream big. What if somebody said, Alexis, for Sacramento, because we know you're rebuilding this market,
Yeah.
here's a blank check. If we like your idea, what is it you would do? What would it look like? And I know you've got a lot of innovative concepts that you want to see happen here.
Yeah, I mean, I would double the size of our team. Many
starters.
hands make light work. Yeah. Gosh, I mean, when I think of numbers like 1 in 2 men and 1 in 3 women will experience a cancer
Mhm.
diagnosis in their lifetime. That's a lot of people to show up for.
So that's half of us, half of the men will have cancer at some point in their lifetime,
Mhm.
and a third of the women.
Correct.
And the thought of that always amazes me because we as guys, and I think most would agree, we think of women with cancer, breast
Yeah.
cancer. That's the novel. That's the
Yeah.
one that we all know about. Wow, it's so prolific. I'm sure ours is probably prostate in some way, shape, or form as the preeminent, but nobody talks about it.
Yeah.
We just don't talk about it the same way. Yet here's 50% of us are going to have some semblance of cancer in some way, shape, or form in our lifetime. More than women.
Yeah. Actually, 1 in 8 men will experience a prostate cancer diagnosis, and it's the same for women with breast cancer. 1 in 8, which I thought that was interesting to your point.
It is, yeah.
I think, the day-to-day, there's so many things that pull you in so many different directions. I think you could eliminate so much of the noise and focus purely on what is the most capable network we could build with what we have here to reach the most amount of people. Like you look at that statistic, well, we got a lot of people to support. I would think of energy put towards what would it take to get every company on our GSEC board to have a robust cancer support program in their HR. Not to say that they don't, but all the big players here. What would it look like to support their employee bases around cancer?
That's
I
a
think
hashtag
of
Barry Broom and a hashtag Mark Friedman, who's the new chair of the board for GSEC now
yes,
too.
yeah. I think of how do we? Oh man, I would put a food pantry in every cancer center that would take one here. The Cultivate campaign, which I know we're going to get to, some of the early research coming out of it in just the last 11 months is that almost 30% of cancer patients enter food insecurity during their cancer journey. So that's not coming to the table already food insecure. That's a whole nother ballgame. But actually entering a state of food insecurity through a cancer diagnosis, that is a lot we could do to support these families as they're going through it. And then it's systems of support for, let's take it beyond, one step beyond the patient, right? We estimate 9 caretakers per cancer patient. That's a big network. Not everybody has that. Some people even have more, but what does it look like to support? You mentioned mental health, financial stability. I think the opportunities are endless in what we could do. It's not a one thing. If I've learned anything in the last year and a half, it's that boy, is cancer messy, and it's really layered. The silver lining in that is, boy, are there a lot of ways we could show up to support people that we love.
You mentioned Cultivate. This is a
Yeah.
great place to talk about it because you say it, who knows what that means? What is she talking about, Cultivate? I don't see it on the website. There's nothing about Cultivate, but it's really significant. And I want you to talk a little bit about it because it's really what we eat and how significant that is to the potential for a cancer diagnosis and or you name it, diagnosis. So
Yeah. Well, I'd love to share a little of where it came from,
please.
too, because it's Sac born and raised. So when I first joined, we did kind of just an overall analysis as a team of where we were at as a market. And we had some really great events. And in their heyday, we're doing fantastic things, 10, 15 years ago. In the current state post-COVID, not financially savvy for us to keep. And so probably most known to a few people is me canceling a golf tournament that was fantastic and was around for 20 years. Actually, in its 20th year anniversary, we sunsetted the event. But the intention being that could we create something that, one, was profitable to feed the work we're doing, right? So the net benefit was better for our business. So we could fund the partnerships we hope to have and create and the impact to have. And then when we kind of started from a clean slate, what do we want to build that is something our own community is going to get excited by? ACS has been around forever. We have, if anything, we are known for throwing really great parties. So I could have had any template under the sun to pull from across the nation. We're probably doing, I just heard about one the other day. I was in Atlanta last week, and it's jet drag, where it's like people come together and they all pull an airplane together. I mean, like, very creative, very cool. It's an airline, raises a ton of money for cancer. I was like, oh, that's cool. We could drag an airplane here. But we instead as a team came up with Cultivate, and the idea being we're already so passionate about our farm to fork roots, our ag community, the role we play in culinary innovation, our Michelin restaurants, the awards that our chefs have and own, all the things that we're proud to boast about as a region. And so, okay, how do we feed into that excitement with something we could create? And it's still being created and morphed, and it's a flexible campaign that we're working on. But then we went to, okay, what is ACS doing in nutrition? Turns out a lot in different sectors of the org. So we are, I would say, in almost every spot of nutrition, from prevention of cancer all the way through to, looks very different for a cancer patient going through treatment. And now with more and more people surviving cancer than ever before in history, understanding what does nutrition need, what are the nutrition needs for people in survivorship, right? So post-treatment as well. And so we decided to build Cultivate. It's intentionally not a food word because we believe, you look at pockets of our communities that are already food insecure. I was talking to Karen at Yolo Food Bank, right? So you've got, I think the stats, 1 in 3 households,
1 in 3 in
right,
Yolo
in
County.
Yolo County. They're also the least likely to get screened for cancer when they should, and then as a direct result of that, have the highest death rates from cancer in their county, right? So what does it look like? Food might be the access point in how we show up for people. It's a great community connector. How do we also step in then as the Cancer Society to, one, support cancer patients, but also be in the dialogue of prevention, right? And showing up for the need for healthy food for XYZ science reason, we all know we should be eating healthy. And so kind of from that idea, Cultivate was born. We had our first annual event. So you call it a gala. It's not a sit-down dinner at all. That was the one rule. No chicken sit-down dinners. And so we actually had Chef Santana joined us, Chef Chris from Localis, Chef Kelly from the kitchen. They were our 3 inaugural chef chairs this last April, and then they brought their friends, the best of the best. And we had 10 chefs and restaurants that showed up. We did a tasting style event and talked about everything we've been chatting about, right? So the 3 pillars of ACS and then the plus. So I think of Cultivate as an and. So plus the lens of nutrition. So like every food any chef was making had a cancer-fighting ingredient. We had Sac State's nutrition team on site as students talking about why this garlic or asparagus is cancer fighting, and just being an informative opportunity to teach people about what you eat can prevent disease. Each person left with recipe cards from our chefs. Now, if you chose to take them on, that's up to you. I looked at some of them and thought, ooh, that's above my skill set. But, there was some that were a little more
I
for
could just use the
us
same
commoners.
ingredients. Maybe I just
exactly.
cook it differently.
Yeah. And then we're also running research. So part of what I shared earlier about the food insecurity. So Cultivate, funds raised through Cultivate. Also locally, we're working with Adventist Health, UC Davis, and the Ride Out team around understanding at what point food insecurity intersects. So I'll say, we learned just from a listening tour that every cancer center here will screen for food insecurity at diagnosis, but not post-treatment. So there's this learning we have here of when we think of how do we navigate and show up for patient-centric care, should we be also talking to them at the tail end of their treatment, right? What does then survivorship look like when you're now food insecure? So it provides a lot of opportunity for us to even just learn how we're responding and showing up here locally. And then forward thinking, another really fun part of it is Chef Santana. We have this opportunity. We're currently creating it with teaching kitchens. So we have best of the best chefs here to add the fun and creativity in the food. And then we want to pull like food you'd get from a food bank and the opportunity to teach the community what's seasonal, what they can use, what's free and healthy, creative. And then what's really fun is the new UC Davis Folsom Center. Working with them will allow us the opportunity to broadcast these teaching kitchens to our 31 Hope Lodges across the country, which will be direct patient support access. Our Hope Lodges are free lodging for cancer patients across the country and their caretakers for the duration of their treatment. And so it's a constant revolving door. And so what we'll do then is create a resource library through the teaching kitchens for patients at any point to utilize and get some fun, creative nutritional support.
And we all know food in is the first preventative measure, but there are also foods that can reduce the effects, consequences of cancer as well. So all these things around Cultivate have so much impact to somebody who may already be diagnosed with cancer, but certainly for the prevention. I mean, we want to get in front of this. That's the number one way to minimize the disease is just to not get it in the first place.
Yeah. Oh, I also forgot another cool thing we did with Cultivate, and it launched about a month and a half ago, is our nutrition toolkit. So we started asking every patient and survivor we met, what did your team emphasize nutrition and all? What nutrition resources were you given? Tell me about, your journey there. Learned that very few patients had an emphasis on nutrition, regardless of system. And it was also one of those, if my doctor wasn't telling me to focus on it, I wasn't focusing on it, right? Because you're hanging off of every word they say with a cancer diagnosis. And so, okay, how do we show up then in the space of saying nutrition is very important? And so we created our national team actually helped us create like kind of a consolidated, not overwhelming 3-page overview of kind of our core nutrition resources that we already have as an organization. And then our local team created, it's about 5 pages of local resources around food, so where you can get. And that's where a lot of the collaboration has started coming from locally, right? So you think of like Center of Land-Based Learning has mobile food farmers market, right?
Yes.
So we have those routes on our list. We have paratransits, people to produce and home to healthcare, right?
Mhm.
So addressing food and transportation. And so how do we lift others up in this journey when it's a resource we're never going to provide as an organization, but they do? And so kind of that all boats rise mentalities.
Mhm.
And then on top of that, we have 2 pages of local cancer organizations
And
too.
how does somebody get that information?
Yeah, so we have that. So through it's in multiple places. It's now fully integrated into, if you called that 800 number and you told them where you live,
Mhm.
that would be a resource that would be given to you. It encompasses all our territory. So
And we will have that 800 number in the show
yep,
notes too, so
yep,
somebody can get it.
and 1-800-227-2345.
Easy.
Yeah. And we also have, so probably the highest concentration of usage is then each of our healthcare systems here, since we already partner with their cancer centers, are utilizing the resource, and holy moly, are they excited about it.
Mhm.
So I think we've had over 200 downloads of it since we launched a month and a half ago. So,
Wonderful.
yeah, that's mostly they're that intersection, right? Your patient navigators, your social workers, their dietitians,
Mhm.
if you're meeting with them. Those are the ones that we want to equip with information.
And so you can just start to begin as the listener going, oh, they probably are talking too. What about the other food banks? The answer is yes.
Yeah.
What about the restaurants? Oh, yep, we're talking to the restaurants for a variety of different reasons.
Mhm.
And I'm sure you're going to be at some point talking to growers if you're not already.
Starting to.
Yes.
Yeah, actually I was on with the Almond Board this morning.
There we go.
Yeah.
That all makes perfectly good sense.
Yeah.
So we come back to reality today. Cultivate it's active, it's happening, it's a big picture piece because I can see how it can really envelop the community and then grow throughout the country.
Hopefully.
Once the vision has been executed here with a beta or a proof of concept, then you're out. What's the greatest need today? What do you see as the greatest need with the organization?
Organization or locally?
Here, yes.
Okay.
Yeah, American Cancer Society, Sacramento.
Yeah, so I would say it's true. Like there are endless days that we feel like we're the new kids in town, right? So you've got an entire staff team without the tenure of relationships that this org's had here locally. So it would be just connections in the community and people willing to get creative with us. And I've been so fortunate to work for these large organizations, but also be able to see that we can still individually touch individual lives. I've been on teams that have created robust strategic partnerships with corporations and been able to see how those trickle down into lifestyle change and culture in your organization and things like that. So to me, it's people who are ready to roll up your sleeves and try something new and, see if we can prevent more cancer, but also show up for those that have it here because it doesn't discriminate.
Mm-hmm. I actually like the way you answered that. You didn't answer it, yeah, it's more money. No, it's more about relationships. It's more about partnerships to where we can work with your organization to encompass all the assets, maybe not just $1. It's not about just $1. It's using all the tools available to us.
I mean, funding is obviously a part of it, for sure.
Correct.
But yes, the relationships are key. And that's something that we're still working to try to get our way in there.
As a donor, most people look at the way the organizations are run, who is the spokesperson per se, and I don't mean that as a talent, I mean it as the executive director or CEO, whatever that title happens to be, to get a feel for the commitment to the organization. What is it that brought you here? Why would a donor say, Alexis, yeah, I'm in?
I would say, when I first started, someone said, every single person is touched by cancer. I thought that was really dramatic statement, but it's true. It's so one, I think in every conversation we have, you're already emotionally tied to wanting to kick cancer's butt. Why our team now? I would say we're ready and primed to just try something new in this market. And that's not to say that the past didn't work. I think the past worked for that time. What does it look like now to partner with ACS? And I think of, what excites me is I think events are great. I don't know anybody in nonprofit that's not going to say yes to someone being willing to hand them $5,000 for an event sponsorship. And if that's what gets you really excited, then that's great. We've checked that box. But I think what gets me really excited is when we can think much more strategically. I almost think you throw the nonprofit piece out the window and what does it look like to accelerate this business forward, which as a product is supporting people with cancer or working to eliminate it. So I think, why us now? I think we have the opportunity in this reset mode to think really creatively. And to try new things. We have a brand new board of directors. They're all excited to get moving. We hope to double in size in the next year. And so, yeah, I think the energy is fresh, and it's a great time to dive in.
And I love the answer because it's not the same old.
Yeah.
Nothing's wrong with golf
No.
tournaments. Those are
Yeah.
just fine. But
I heard we had puppies at some holes, which that would have really won me over. But yeah,
Right.
I know.
and it's time for those novel concepts. I mean, Sacramento is going to have this huge food event coming, Tierra
I
Madre.
know.
That's really unique. That's different.
Mhm.
That's not a food fest of some sort, or a best of food
Yeah.
in Sacramento. And I think we do need to look at things differently, certainly because things are being funded differently today. Today, meaning
Mhm.
yesterday, literally just yesterday, it was
Yeah.
one way, and today it's different.
Yeah.
And everybody has to accept that and think of new ways to do what they need to do to not only survive, but of course thrive if they want to grow their organizations. How about a success story or two? You have anything you could say? We've seen this come through. Here's some of the things that we've done. Could be with a relationship with one of our healthcare partners or an individual.
Success story. Well, I mean, our board. Can I give you more than one?
Oh,
I'll give you two.
yeah.
I'll two different examples. So, I mean, our board, we've got 7 individuals on it, and all of them are new to ACS. And I think 6 of the 7 was cold outreach from our team on LinkedIn. If you had talked to me, a couple years ago around cold outreach, I would have been like, ugh, I'm like 15 years plus into nonprofit life, and cold outreach sounds like a thorn in your side. But the reality is just to have those conversations with individuals. And it was just like, can we grab coffee? Can I share with you the vision for what this market can do? And then their excitement, just meeting us and choosing to come on the board and trusting the vision and helping us shape it. Because, I'm not one person at the helm here. Like, this is a creative group, and I love their strategic thinking and how we move forward. Those are all small wins, right, of new intersection. We have even a board member, too, who was actually chair of the board and been on it for 10 years, right? So adding in that historical context, too, of knowing what we've tried, what we've done, how do we reshape and move forward. Another success story, I would say, and I can't say the name of the healthcare system yet, but
If I ask, how many of those cold outreach LinkedIns did you touch before you got enough to assemble a board? Do you know what the
Oh my
percentage
gosh.
was?
I bet half your listeners are like, yeah, she slid into my DMs too. But I mean, cold outreach, we're still in the hustle of cold outreach.
Okay.
So, oh my gosh. I mean, it's probably for every, I feel like there's also a science to what you say in your message, but probably for every 20 I ping, I get 1 response.
Okay.
Yeah.
What a novel way to do it, though.
When you don't know anybody here,
Yes.
right? We're all new. We all don't bring connection. I even though I lived here, my work life was the West region, Bay Area. It wasn't here. So truly 0 connections on the team when we first started. So,
But you're not recycling a lot of the same people who, and I don't mean that as a negative, but you get to choose. You can, I'm cautious in how I say this because I think so many boards are mature and they've been mature and they continue to be mature. And we need some new thoughts and we need some new ideas and we need some really creative input for our organizations to do what they need to do today, not the stuff that we all have been familiar with.
yeah.
And that's hard when you have a mature board Or those same people, they come off of one board, they cycle out and they go to another. And we love them. It's wonderful. We need the support. But we also need that rejuvenation
Yeah.
of board activity and board membership. So cold out into LinkedIn, I've not heard anybody do that.
Oh, well.
There we go.
There we
so
go.
there's a novel concept,
To tell the team that, yeah.
right?
Yeah.
And we've talked to a lot of people.
Yeah.
Never heard anybody reaching out that way.
I think and there's pros and cons, but it's some of the like I mentioned, I've been doing this a long time, and some of the coolest people I've met have been the last year and a half been here in Sacramento. My husband gives me a really hard time because I didn't love living in the area, partly because I wasn't integrating myself in the community when I lived here the first 6 years. And he gave me grief the first time. I think I was 3 months into the job. I had just met with someone at Sac Republic, and we went to a game and bought a hat. My husband's like, "Who are you?" It's like, "You're wearing Sacramento." I'm like, "Yeah, so we should be proud." He's like, "Oh my gosh, this is like a complete 180.
Yeah.
But yeah, so I really have fallen in love with the people here and the work we're trying to lead. And yeah.
And that was one story. You were going to say another.
The second story I would say, and I won't mention the healthcare system yet. I'll be blasting it from the rooftop once it's finalized. But we're talking to this team, and they've historically been a 5K sponsor of Making Strides. And the conversation came from a board member who just introduced me to a friend. And it's, the first ask isn't, will you do 10,000 instead of 5? It's kind of to your point. If what could we create? There's a blank check. Or if there was, like, what are your strategic goals that you have as an organization? And we learn it's, addressing social determinants of health and, health equity work. Great, us too, So what does it look like to go from this big picture vision down to what we could do locally? And from that is now shaping into a statewide partnership being led by our Sacramento leadership too, bringing in more and more people from their organization. And we're talking about now launching, likely in 2026, we have this incredible I Love You, Get Screened campaign that, educates and informs communities about the importance of getting screened, right? So you have, in some cancers, almost a 90% better success rate if your cancer is caught early enough, right? So, we can target to populations like Yolo County and then push them towards access points for screening, free, reduced, covered, and then from there, track data and help these systems with their own things they're tracking, which is screening numbers and prevention. And so what does it look like to work collectively together? And it's now turned into a statewide campaign with a big focus on Northern California, which I'm so excited to. More to come when that's official, but
can't wait to hear.
I know, yeah. But I mean, that's a great, a lot of people. I got feedback when I first started from a healthcare system that said, to be honest, we don't really need you. And that was really an eye-opening statement for me. I was a month in on the job, so you can imagine I was like, oh, what's my response here? And I didn't need to know a lot about cancer, honestly, because I thought, one, what a statement, and two, realistically, ACS doesn't need you either, right? But can't we do exponentially more together? If we both have the same goals, I don't understand why you wouldn't collaborate on something to enhance both entities. And so I think that is the mindset I try to keep when I'm talking to even a smaller cancer organization. That one could look at this as we're all going after the same dollar, but I think if you look at that in that mindset, you're completely limiting your impact potential. Sure, we are, yes, all vying for the same dollars, but again, at the core of what we're in this line of work because we believe in bettering our communities and whatever the org is that you represent, right? So leaving it better than we perhaps found it. And so, like I think of like I'll Be Aware or Keaton's Cancer or Triumph is a great one. Me One Foundation, all things we will never provide as an organization. But I hope that if my family's dealing with a cancer diagnosis and I apply for Me One because I heard about it through ACS, or I get the opportunity to do a 12-week free exercise program specifically tailored to my needs.
Mm-hmm.
I just think that's such more well-rounded approach to bettering our communities.
I was hoping you were going to say me one because you heard it through the nonprofit
I
podcast.
actually did. And then I was at UC Davis's Cancer Survivor Day, and we were at the booth next to them, and I went over and
Aren't
talked
they
to the
incredible?
executive. Oh, incredible.
Yeah.
Yeah.
I know they just filled up their camp
I know,
that's
yeah.
coming up, and they filled up their volunteers and everything, so they're good.
I know.
Good
I
to
missed
go.
the volunteer deadline, but I would love to do that one day with one of my kiddos.
Yeah,
Yeah.
it is very, very neat. I love the way that you're looking at it. I love the way that you're approaching the organization with a new set of eyes from a different perspective, trying things that are different, because we're all there today. Everybody has got to do things differently than they've done them historically, or they aren't going to look the same
Right.
as they've looked historically if they make it, because everything's changing, and it's changing so fast. And I think the benefit you've got is you don't have that legacy of this is the way we've always done it, because it's cycled in and out and up and down, and it
Mhm.
doesn't look the same as it did before. So you're starting fresh and looking at relationships differently. And food, I think we all would rather see anything prevented as opposed to treated.
Right.
Symptoms are bare.
Mm-hmm.
Cause is the thing we'd like to eliminate. So you're marching down that path, and I think that's what's really, really beautiful about the way that you're approaching it. I mean, a couple of years from now, we're going to talk about this and
Right.
see what that looks like
Yeah.
and what
Did
this
it
cultivate
succeed? Yeah.
and did it work, right?
Yeah.
Well, I can usually come up with some really nicely worded closes, but the significance of what you do at the organization, the depth of service, the commitment to the patient, the research for the medical community, which I probably would guess is the most money goes into the research.
Yeah.
It's just the sheer scope of this disease and how many people it impacts and touches. We need to know more. We just need to know more, and it needs to exist because, if I'm not mistaken, your funding is predominantly self-originated. It's not big tons of government money coming
No.
at your way. You get a little bit here and there, but we are supporting that, and organizations are supporting it, and businesses are supporting it. So thank you for what you do. Thank you for making the decision to transition over to American Cancer Society with all these new ideas. And I think a lot of people are going to be hearing this and going, I know I need to rethink it. It's so hard to make that change, but I need to maybe talk to Alexis. Maybe there's something there for us too in looking at this thing a little bit differently. So I appreciate you. Thanks for coming in. I know
Thanks
you
for
have been
having
an
me.
advocate of ours, and I love that
Oh my
too.
gosh, I've learned so much from. That's how we actually got connected to a lot of our Cultivate partners was Jordan on my team who leads Cultivate, and I listening to the different. If anything came up about food, we were like, oh, who's this? And so then we'd reach out to them. So thank you for the resource you're providing.
Absolutely our pleasure. I hope to hear more and more and more.
Yes, we'll come back with updates.
And Alexis, you want to give that 800 number again? We will put this in the show notes, but just for
Sure.
the benefit of, go ahead.
Yeah, 1-800-227-2345. And
Okay.
then our website is cancer.org.
Perfect.
And then our advocacy arms website is fightcancer.org.
Okay. Easy enough. And like I said, those will be in the show notes, so anybody can just look and find them and click, and it'll take you right to those
Perfect.
resources with the exception of the phone number.
Yeah. Don't try to find our local websites or social handles. They're being centralized through national. So those would be the place to go, or even shoot me an email, alexis.padilla@cancer.org.
And that's Alexis, ALEXIS.PADILLA at cancer.org.
Yep.
Okay, I'll have that in the notes too.
Perfect.
Thank you so much.
Thank you.
Thank you for listening to the Nonprofit Podcast Network. I hope you enjoyed the episode. If what you heard moved you, please reach out to that organization and do what you can to help. If you like and appreciate what we're doing to support local nonprofits, please give us a positive review, subscribe, and share. If you're a nonprofit with an interest in participating in an episode, you can reach me at jeff@hearmenowstudio.com. Once again, we're grateful for the businesses who have made this program possible. CapTrust, fiduciary advice for endowments and foundations. You can find them in Sacramento, Roseville, and Folsom, captrust.com. And Western Health Advantage, a full-service healthcare plan for individuals, employer groups, and families. westernhealth.com.